Hey there, Mary Sheila here with BioYouth Labs, and I'm going to talk about another conversation about blood sugar, but in this one about alcohol. Yes, it's true. It is a big conversation because, number one, it's so prevalent in adults, teenagers too, but in adults. And sometimes we can lose sight of the effects that it could be having on our body. So, I'm talking about blood sugar balance, but even brain health, it can play a big role in brain health. And alcohol can have both short-term and long-term effects on our blood sugar levels. So when we understand these effects, we can make more informed choices that can help us with if you have diabetes, or if you're concerned about blood sugar, or if you have pre-diabetes. But it's an important conversation for us to have because alcohol can cause a rapid drop in blood sugar levels, and that can cause, for some people, hypoglycemia, which is low blood sugar. And this can happen shortly after consuming alcohol, especially on an empty stomach. While alcohol can initially lower our blood sugar, it can lead to an increase in blood sugar levels several hours after consumption. This is because the liver metabolizes alcohol instead of releasing glucose, potentially causing an imbalance. So moderation is key when it comes to alcohol. And I know we know this, but sometimes, one drink leads to another drink leads to another drink. So drinking alcohol in moderation is essential for maintaining blood sugar control. Excessive alcohol intake can lead to erratic blood sugar levels and other health issues. Now let's talk about some ways to support our blood sugar while we're, if you are consuming alcohol. If you have diabetes or other blood sugar related concerns, you want to consult with your healthcare practitioner before consuming alcohol. And they can provide you with more personalized guidance based on your specific health status and medications. And sometimes just owning up and talking to somebody, especially, a doctor that you trust and who knows you, can be the gateway to maybe making some changes, because maybe, alcohol is not serving you and it's something you do want to stop, but having that initial conversation is going to really open the door to creating change, because there is a lot of support out there for people that might just know that they are drinking too much alcohol, and then as a result they're drinking too much alcohol and then eating too much food, because it just kind of muddies up those waters, and then they don't sleep good, right? And then you wake up in the morning and we know there's a pattern with it. A lot of people know. That's why a lot of people don't drink, right? And that can be challenging too, but it's totally possible. So if you really want to see how it affects you, you can always check your blood sugar before, during, and after drinking alcohol to understand how it affects your body. This information can help you to make more informed choices. Eating a balanced meal or snack before drinking can also help you prevent that rapid drop in blood sugar levels, right? So you're not drinking on an empty stomach. And you want to opt for lower carbohydrate mixers. So, be mindful of drinking things that have a lot of sugar already in them, right? Because then you're getting the alcohol and the sugar. So that's really going to play a role on your blood sugar balance in general. And it's going to affect the liver as well. And, another way to kind of really check your alcohol is to become the designated driver, because then you can order a mocktail and not drink and still have a good time, hopefully. And I say hopefully because sometimes it really is a great way to not drink. You get to watch everybody else have fun, but you can have fun with them. And you also can have fun knowing you're going to wake up feeling great the next morning. And the guidelines for alcohol consumption, even if you followed those, which is typically 1 drink per day for women and 2 drinks per day for men, right? So if you can keep that in check, that's going to be better than if you're doing more than that. But you can also not drink alcohol, and you can also drink less alcohol and save it for a special occasion. So if you are aiming for optimal blood sugar control, consider reducing or eliminating alcohol consumption. And the other thing is to stay hydrated. Drink water in addition to any alcohol you're having to prevent dehydration and help your body to process the alcohol more efficiently. You can also learn about the carbohydrate content of different alcoholic beverages. Beer, wine, and spirits, they can vary significantly in terms of carbohydrate content. But remember, even if something is low, is whatever the alcohol is, it's still going to affect your blood sugars. So if you do take medications, especially for diabetes, you just want to be aware of the hypoglycemia and hyperglycemia effects of alcohol. And, make sure that it's not contraindicated with the medications you are on, because actually a lot of medications say not to drink alcohol on them. So we have to be mindful of the fact that we are taking a medication, and, alcohol is a drug as well because of how it affects the body. So there can be some serious consequences with mixing those two together, right? So, oftentimes when we are on a medication, we might have a goal of getting off of the medication. So we have to be mindful of all the different drugs we're putting in our body. And the less we put in, the more chance we can probably get off of our medications if we're really treating our body right, every day, right? And not doing any binges or, drinking daily and things like that. Okay, I hope that is helpful and gives you some tips around alcohol and blood sugar, and just know there's a connection and interaction. Thanks for watching, and I will see you next time.